The American Embassy in South Africa has pledged full support of the South African government and how it's conducting its efforts to contain and eradicate the coronavirus epidemic. We're joined now via Skype by the Ambassador of the US to South Africa, Her Excellency Lana Marks. A very good morning to you, Ambassador.
Good morning, and it's an honor to be on your show. Thank you so much for having me.
America is on the banned list of inbound and outbound flights for South Africa. What should Americans who are here and are trying to leave do?
The safety and safety of all Americans in South Africa is my #1 priority. I advise them to look at the US Embassy website. We have a COVID-19 separate section. To look on travel.state.gov website and also on the CDC website, and contact their local airline or find out as quickly as possible how to get out of the country back to the United States. On March 19th, the State Department issued a travel alert for American citizens to return to the United States.
Ambassador, in announcing the state of disaster 2 Sundays ago, President Cyril Ramaphosa said he would ask you to redirect the resources meant for PEPFAR into this effort. How is this being done, and how does it speak to how the US is helping financially?
We have, in this month, donated an additional 8 million rand through USAID. And this, together with our PEPFAR partners throughout the country, will assist both financially and with resources to assist all these partners. This is in addition to the PEPFAR funds, and will assist not only financially but with technical support, with staffing, and as I said, both on the regional and provincial level.
America itself has been hard hit by the coronavirus, but there are global concerns that the President, Donald Trump, is misleading in his regular media briefings and not providing proper leadership as scientists disagree with him from time to time. How are you disseminating the messages as they come from Washington?
I was in Washington recently, a couple of weeks ago, and at the White House, and I personally to the extraordinary vigilance and response of President Trump in this global pandemic. Fact is fact, this and unfortunately because of a lack of transparency, it has gone global. And President Trump has brought on board the top experts of the United States and the world. Ambassador Birks, Dr. Birks, who is very well known by South Africans with PEPFAR, who has saved millions of lives, Dr. Fauci, and President Trump is incessantly in contact with the top experts and is being magnificent in his approach to combat this both in the United States and globally.
Why then, Ambassador, is there a sense that the government is dithering? People are said not to know exactly what to do because government is not providing clear guidelines. What is the official position of the USA on the fight against COVID-19?
There are very clear guidelines. There are very clear guidelines both in the United States and South Africa by both of our democratically elected President Trump and President Ramaphosa. And people should avail themselves of these websites again and take strict adherence to physical distancing, washing hands, look at the CDC guidelines daily. They are updating constantly, and President Trump is in constant contact both with these experts, CDC, the Center for Disease Control in Atlanta, as well as many of the governors that are hardest hit throughout the United States. We commend President Ramaphosa for his strong leadership in South Africa, for taking dramatic action to protect South Africans in the COVID-19 pandemic.
The USA is one of the countries that the world is looking to in terms of finding a vaccine. What's the conversation there at the moment? This is another a point of contention in terms of people feeling there is no leadership being provided.
This is a new pandemic. This is a new virus the world has never seen before. President Trump has been extremely proactive with private industry, with academia, with the international community, bypassing many of the local regulations in the United States to find a vaccine for this pandemic as quickly as is possible.
What's the U.S. Embassy in South Africa doing in terms of practical activities in this fight?
We are all practicing physical distancing. We are teleworking. The vast majority of the mission is working from home. I'm working from home. I've gone into voluntary distancing myself, and mission throughout the country are according to the guidelines offered both by the United States and by South Africa.
Ambassador Marks, these are tough times, as you said. Many people have said uncharted territory. What's your sense in terms of timelines as the lockdowns get underway in different places? In the US especially, there's now a lockdown in New York, and different governors are taking decisions about their different states. Does this not in a way show disharmony in a way?
Different governors of different states have to handle this differently. For example, New York State has to handle it very differently than Montana, because Montana obviously has to handle things differently. New York is an enormous city, an enormous state with a huge population, very densely populated. So the governor there has to handle it differently. President Trump is taking extreme measures on every front. The safety, security, and well-being of all Americans is his top priority, and he is taking every measure possible, both to find a vaccine, to protect Americans, and to help the community.
Just please unpack for us the specifics of the funds that are directly going to the effort to stem COVID-19. Where specifically are these funds being directed to?
Congress has passed 1.8 billion global funds for COVID-19. This month initially, we have USAID has granted an additional 8 million rands for South Africa. This goes towards administration, towards our local partners, and assisting in any way possible with our local PEPFAR partners in the administration, in personnel, and in every respect possible that we can, together with our South African partners.
Ambassador, thanks for talking to us this morning. I just wanted to say the last time we spoke to you, you were still an ambassador designate. Let's just congratulate you on your full accreditation. How has that been?
Absolutely marvelous. One of the days of my lives is when I was accredited by President Ramaphosa. It was an extraordinary day, and I'm very deeply honored to serve the United States in the country of my birth, South Africa. Thank you so much for mentioning that. I'm enormously grateful.
How are you going to be coping personally in the next 21 days?
In the next 21 days, I will assist our mission in any way possible that we, the United States, can assist President Ramaphosa's strong stance in South Africa, and we're all working together as a team with our South African counterparts, and we're working very, very hard, very long hours, and we want to be as help as possible to South Africa as the global leaders of public health in the world.
We hope you'll be available to talk to us throughout this period whenever there is a need. Ambassador Marks, thank you so much for your time.
Please don't hesitate. Thank you very much indeed.